Hi, my name's Dr. Bloom, and I'm going to be the physician who is administering your ear examination today. Okay. Please have a seat, get comfortable, and I'll do the same. And before we begin the examination itself, I'm going to be asking you a few questions about your medical history, specifically about your hearing and your ears. I know that reception already gathered your personal information from you and your insurance information. Yeah, so I just have another just brief set of questions to ask you pertaining to your hearing. Okay? All right. Now, do you have any concerns right now with your hearing? Okay. And when did those problems start becoming noticeable? All right. Now, is it one ear specifically or both ears? Just your right. Okay. Okay. Now, have you been exposed to any loud noises lately? Mm-hmm. All right. And in either ear, are you noticing any pain, discomfort, swelling on the external portion of the ear, any secretions? Yeah, such as blood or liquid? No? Okay, that's good. Well, that generally means either infection or that there has been damage done to the eardrums, so that's good to hear that there's not been any noticeable side effects. Wonderful. Okay, then. And do you use anything normally to clean your ears? Do you use kind of cotton swabs in the ear canal? Or? Okay. Yeah, we generally, in fact, I'm going to be specially made. Yeah, I'm going to be using some specially made cotton swabs for your ears today. But we generally suggest that you don't put anything inside your ear canal. It tends to just push the wax and any debris or dust that you might have further into the ear itself, so it tends to do more damage than it does good, and you can also irritate the ear. Now, do you notice that you've been having problems with earwax buildup? Before you leave today, then, I'll be giving you some special ear drops that you can use. You just put one in each ear whenever you're feeling as though you're having a bit of buildup, and it'll help clear the problem up, okay? Yeah, it's perfectly safe. It's all hypoallergenic, so perfectly safe to use. Okay, fantastic. So what I'm going to be using today is, what I'm going to be doing today is I'll be doing an external examination of the ear. So I'll just be taking a look at, kind of the earlobe and the, all of the external portions that are visible to the eye. And I'll be maybe cleaning them out a bit just to get any debris out of the way and any dust that you might have. And then I'll be doing the hearing exam, where I kind of test your ability to hear different types of sounds and different sound levels, just to kind of test your auditory functions. And then if I find that you do need a bit of a cleaning, I'll go ahead and do that for you today. All right? Okay, great. Okay, so I'm going to be swabs here. And, I'll actually get out a couple. And yeah, this will just be for the external portion of the exam. And then I'll be jotting down some notes. So don't pay any mind to that. Just kind of relax and try to focus on maybe any questions that I may be asking you throughout the exam. Yeah, throughout I will be asking if you can hear certain sounds that I'll be mimicking, and you'll just need to tell me if you can, okay? Great. Okay, so what I'm going to do now is I'm just going to clean the outside of your right ear. We'll do the right ear first. Okay, I'll go around over here. I'm just going to be checking, see if there's anything out of the ordinary. Okay, hold on a sec. Alright, it looks good on this side. I know that you said this is the ear you're having the problems with, so, but there's nothing externally that's of any concern really, so I'll be heading over to your left ear now. Okay, so let me take a look here, and I'll use the cotton swab again just to kind of clear away. You have a bit of dirt or dust on the outer rim of the ear here, so I'll just kind of get that out of there for you, okay? Alright, yeah, this ear looks just fine. Doesn't really look like there's any sort of irritation or anything, so that's very good. Just jot that down. Okay. So I'm going to be going back to your right ear now, and what I'll do is I'm going to kind of shine a light on it, on the ear canal, and then I'll be blowing some air to kind of see how the eardrum reacts to the pressure. And I'll also be carrying out some basic auditory exams on that ear, and then we'll move on to the left, okay? Okay, again, if you're nervous at all, there's nothing to be nervous about. This isn't going to be painful whatsoever. Okay. Okay, we're at the right ear now. So let me just have a look in here. I do see a little bit of swelling, a little bit of irritation. In addition to the cleansing ear drops that I'm going to be prescribing you, I'll also give you some drops that will help to kind of reduce the amount of irritation and kind of calm down that swelling that's going on there. Okay? Okay. Now, what I'd like for you to do for me is I'm going to just sit perfectly still if you can. I'm going to just blow gently into your ear and see how your eardrum reacts to the pressure, okay? Okay. Alright. Okay, it's doing beautifully. Yeah, it doesn't look like there's any issues with that. So, what I'm going to do now is I'm going to just whisper into your ear, and I'm going to start off, I'm kind of at a more elevated tone, and I'm going to start with the number 10, and I'm going to count backwards to 1, and as I count backwards, I'm going to kind of soften my tone, and I want you to tell me at which number you can no longer hear me. Okay, so for instance, if by the time I get to number 4, it starts getting a bit muffled, or you cannot hear me at all, then let me know, okay? Okay. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right. Now, which number did I start kind of fading out? Were you able to hear all of them? Okay, fantastic. That's wonderful. That's what I like to hear. Now, do you find that you have any difficulty hearing different pitches in tone? So, for instance, a deeper voice or a higher pitched voice? No? Okay. Okay, I'm just going to do one more test then. On this particular ear, I'm going to be saying different words and in different tones, and I want you to hear me, tell me which particular words you can hear. Okay, as I go along, alright? Okay, so after I say a word, just go ahead and say yes or no. If there's a pause, of course, that means that you didn't hear the words. Just go ahead and say no, okay? Yeah, I'll ask you if you don't respond to a particular word, definitely. Okay. Chocolate. Mm-hmm. Sugar. Recipe. Wonderful. Cinnamon. Okay, were you able to hear me that time? Not really. Okay. Nutmeg. Okay. Perfect. So it's only the very, very soft tones that you have a little bit of difficulty with. Okay. So, now I'm going to go over to the left ear and we'll do the same sort of test on that, okay? Okay. Are you comfortable? Good. Okay. I'm going to kind of have a look here. Shine a light in there and see if anything's out of the ordinary. Okay. Well, it all looks good with that side. Yeah, I definitely don't see the same amount of irritation that you're getting with your right side. There's, it looks all normally colored and normal size, so there's no irritation there from what I can see. Yeah, this side's looking very good. So you won't need to use those ear drops for this particular side, only for the right ear, okay? Yeah, the anti-inflammatory drops. Okay. Okay, so I'm going to be doing just the same kind of test that I did for the other ear. I'll be blowing some air into there first, okay? Alright, that all looks great. It's reacting normally. Okay. Now I'm going to count back from 10 again, and again, just let me know if you can hear all of the numbers. Alright? Okay. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, you were able to hear. Okay, wonderful. All of them. That's perfect. Now I'm going to be saying some different words again, and just let me know which ones you can and cannot hear, alright? You're doing beautifully. Okay. Apple. Watermelon. Marshmallow. Great. Pear. Cream. Product. Okay. Fantastic. You did beautifully. You were able to hear all of them, so that's what I like to see. Okay. Now, when I was looking at your left and right ear, I noticed that there was a bit of wax buildup just on the outside. What I'd like to do, if you don't mind, is I'd like to clean a bit of that away. It's just right inside the ear canal, and I do have a special tool. It's a special instrument for that, so I'll be able to help you with that today. And yeah, that'll get a good amount of it away from the ear canal, and then you can just use the drops as kind of a maintenance. Okay? Okay. Fantastic. So I'm going to, since I'm already at the left ear, I'll go ahead and start with that. And again, I'm just going to be cleaning around the very, very rim of the ear canal there. So I'm not going to go too deeply in. I don't want to irritate it, okay? Okay. Alright. And now I'm going to go ahead and go over to the right here. Okay, I'm going to do the same with this ear, okay? Wonderful. Yeah, we're all through actually. Let me just write down a couple more notes here. Okay. Yeah, well, that was it. You did beautifully actually. I don't really see any problems with your hearing. I think the only issue of concern I had was with that right ear. It is a bit swollen and inflamed, a little bit irritated, but I think that the medication I'm going to be giving you will take care of that. If in a couple weeks you notice it is still kind of bothering you a bit, please give me a call and we'll schedule a follow-up appointment as soon as possible, okay? Okay, do you have any questions for me? Okay. Yeah, I do recommend that you get your ears cleaned by a professional at least once a year. Kind of judging upon the amount of earwax that you normally have or the amount of dust that you normally have settling into the ear canal would be kind of a guideline for how often you would have to have it done. But it didn't look like anything was too bad in your ears, nothing I was really concerned about, so I'd recommend you coming to see me at least once a year, if not every 6 months, just to kind of check on everything and make sure everything's in tip-top shape. Alright? Okay, well, that's wonderful. I'll send you away with the prescriptions for the eardrops that I told you about, and they should clear things up for you. Okay, great. You take care, and I'll see you soon. Bye.